Dr. Emanuele Capobianco, who's the head of health and care at the International Federation of the Red Cross and Red Crescent Societies, live for us in Geneva. Good to have you with us. We've heard some appalling stories which have emerged from care homes around the world about residents being found dead or sick with coronavirus. Why are residential care homes struggling so much to cope with the coronavirus pandemic?
Residential care homes are struggling because they are places with confined spaces and lots of people. That's what the virus likes, people with lots of people. And second, the virus is particularly lethal among old people. If you put 100 young people in the proximity of the virus, you would have only a few with severe symptoms. If you put 100 old people, you have a lot of people sick. And that's what is happening all around the world. You just presented the case in the United States, but we know that 1/3 of the cases in France, of deaths in France, are of people in this home care. We know that 4,000 and more people died in a month in Madrid. We know that more than 3,000 people died in Italy in home care facilities, and this number is probably a big underestimation of the real number.
And we've known right from the start of the pandemic that the elderly are among the most vulnerable for this virus. So how can they be better protected, and what lessons can be learned from the experience so far?
So we knew it from the very beginning, and so the steps also to protect the elderly are fairly clear. First, social distancing, so reduce the number of visitors, block visitors to home care facilities. Second, bring in the measures in terms of hygiene and protection that are needed to reduce the spread of infection. Personal protective equipment for all the personnel in the facilities, use of soap to wash hands, and the other normal protective measures that need to be taken place. Third, test all elderly people with symptoms, and if they test positive, you need to isolate, you need to quarantine the other people that have been in contact. Last, if the elderly get sick, they need to be referred to hospitals that have the equipment and intensive care unit to help them.
I'm sure that organisations like your own have been extremely busy during this outbreak. Specifically, what has your organisation been doing to help the elderly?
So we have been supporting the vulnerable people wherever they are, and the elderly are clearly one of the most vulnerable people in this epidemic. And what we have been doing is supporting them first with information, providing the right type of information. Second, by helping them fight the isolation in which they're in, and providing a lot of psychological support through our volunteers. And third, we have really spread a number of acts of kindness supporting the elderly by bringing them food, by bringing them medicine, and just being close and responding to the needs that they may have. And this has been done through our amazing volunteers. We have 30 million around the world at this moment are supporting people in need because of this COVID-19.
Dr. Emanuele Capobianco, thank you very much indeed for joining us.